The slides are visible?
Yes, sir.
Yeah. Good morning, everyone. Today, I'm going to talk regarding data-driven decisions, meta-analysis for clinical pharmacy advancements. Particularly, as you know, this particular that quote, research research is the activity that makes the pharmacy as a science rather than a technical skill, which is actually told by 1980 American Association of College of Pharmacy, particularly in contest that research is one of the important component of the pharmaceutical sciences. Why this particular quote is developed? Because today's world is moving towards more than the whatever basic science, it is to the applied research. When you see this particularly, we always talk from bench to bedside. But nowadays, majority of the things, we have a realistic problem in the bedside. And for that, we are coming back to the bench and again doing the research and going back to the bedside. This is one of the major observation we are observing nowadays in our research. Whenever we have a clinical associated problems are there, generally we won't get a solution for that. Generally, we will come back to the bench side, we do some research, then again we will apply even any medical field, including even the management strategies, it is holds good. Whenever we say that bench sites, it is mainly focused on, that all the drug discovery, drug development, animal safety studies, whereas come to the clinical research, it's mainly the phase 1, phase 2 studies. So these all the combined together, we are applying our normal pharmacotherapeutics, which is considered to be the one of the important aspect, and this will be clubbed with the patient acceptance, physicians view, and as well as the even economics involved at that. Economics is considered to be the one of the important component in the management, as it contribute the acceptance towards the either clinician or the patients. So we have in between, there is a practice based research. What is this practice based research? Practice based research is nothing but it is particularly focused on the evidence synthesis, which particularly holds good with the either acceptance from the physician as well as the even from the patients, become the evidence based medicines. So generally, that these are the major roles of the pharmacist in the research, which is I need not again focus on that. But when come to that, our main thing is practice based research. So practice based research is one of the important component which we mainly focus on, particularly to the patient, which is converted into a patient orientated research. Then with that, we are going to apply the various dynamics of the research, including patient's acceptance, physician inputs, as well as the for that how the economic impact will happen. Generally, when you say the implementation science, it is one of the important growing thing, since now this ICMR is initiated the guideline development, where this strategy of the implementation sciences holds good. Till date, we are following either the WHO guidelines or the other any association specific guidelines to the management strategies. But as a part of the things from last year, ICMR has been took initiative for preparing their own guidelines, which is mainly handed over to the technical resource center, where we are the one of the technical resource centers we are working for the guideline development. The guideline development is equally important when connected to the evidence-based medicines. So a gap between the development of the research that improve the medication use and translation to the evidence-based intervention in the clinical practice is well recognized. As we know that one, particularly the evidence synthesis, which is done in a systematic way with the specified inclusion exclusion criteria, and from there the conclusion will be framed either qualitatively or quantitatively. What is meant by the qualitative synthesis? When you say the qualitative synthesis, it is mostly the opinions which is there in the articles which will be extracted, Whereas when you are representing that results in terms of the statistical analysis, it becomes quantitative data. So when you are qualitatively synthesis, such information leads to a systematic review. When you prove your qualitative results with the quantitative data, it becomes the meta-analysis. So generally, the major focus is in the implementation science to identify the gap. From the gap, you have to collect the evidences and come with the proper what we can call as a conclusions. So evidence-based medicine is considered to be the one of the growing era in especially the Indian setting from last year. So why it is required? As we know, India is a diversified country where there is a regional practices, regional acceptance, cultural acceptance are considered to be the important thing. So only the evidences from the research data may not be sufficient to give the answer. So apart from that one, there is a need of the patient acceptance as well as the physician input for this same will be considered to be the one of the important component. So generally we may say that one, no, when you say that Googling can be one of the strategy to get the evidences, but it is may not be true. When you define the particularly your any area or the research gap or the research question with the specified terminologies, that is what we called as a PICO. What is meant by PICO? That is the population, intervention, control, and outcome. A specific question will be categorized into that one, and you are putting the keywords in the terms of the PICO. It is going to give the relevant article. However, if you put like that, a specific like the any question to the Google or any randomly you are putting the keywords, it may not give the appropriate searches. Just try with your own thing. When you say diabetes management, metformin, glibenclamide, if you put that one, you will always tend to get the overlapping articles, which is more than 1 lakh, 2 lakhs. Suppose you use the same keywords, particularly associated with diabetes mellitus, metformin, glibenclamide, diabetic sugar control, or you can tell that particularly the HbA1c, then you are going to get more relevant articles. So using the key terms are considered to be the very, very important in getting the information, especially in terms of what we can say is in a systematic review. The more precise the key terms you are using, based on that your relevance of the article will be whatever you are going to get from the specifically from the Google will be more precise. So when you say that evidence-based medicine, the best research evidences which we try to club with the clinical experience and patient preference. So why these are three important things required for the evidence-based medicines? So I cannot say that there is a X drug which is giving 100% success, or we can say that there is a no death or no mortality. So it can be considered to be the very superior, and it can be used by research data, because there are several hurdles are there. It may have a difficulty in the clinical settings. So that's why it is very, very important when you say evidence is collected from the literature has to be given, take an opinion with the doctors. And if doctors are even also give the positive preference, but the affordability with come to the patient is also considered to be the important. So there is a need for, when you say evidence-based practice, it is a clinical expertise which considering the best evidences practice and combining with the patient values, it becomes the evidence-based medicine. So a systematic review or the meta-analysis is the part of your evidence-based medicine, and based on that we are collecting the furthermore like a clinical expertise, which can be in terms of the qualitative interview, or it can be in terms of the expert opinion, or it can be in terms of the feedback, followed by patient's values or patient preference regarding the particular management aspects, combined together, it becomes the evidence-based practice. So what is meant by evidence synthesis? Particularly, evidence-based practice will start with the evidence synthesis. It means that collecting and combine the information from the many research studies to answer the question. So, example, if you say, what is the best treatment for snake bite poisoning? It is our research question. So, in our research question, what is the best treatment for snake bite poisoning? So, particularly evidence-based medicine will try to help out to take up the different research studies which is focused on particularly the different aspect of the management, including it may include your local practices, it may include the antivenom, it may include the even the herbal medicines, or whatever the available practices, it try to pool. From there you are getting the specific inclusion exclusion criteria and you are going to synthesize your information. So generally the evidence-based medicine is a systematic approach. Generally it start with ask. So what example, another example I am going to give here. What is the medicine can save the farmer from the pesticide poisoning? When I am talking that one, which is the best medicine? What, when, how? These are the common questions which is you are going to ask in the evidence-based medicines. So what is the best medicine for the pesticide poisoning? So what the generally clinician will do is they try to find out which is the best guideline is available for the pesticide management. When I talk about the pesticides, it most commonly refers to the organophosphates. So patient comes with the organophosphate to particularly poisoning with the emergency settings. So generally when it's they identified through the maybe you can say either blood test or the toxin syndrome, which is nothing but a clinical syndrome which will identify the pesticides poisoning or organophosphate poisoning. Then doctor try to understand which will be the best source for information. They may find the source like WHO guideline, online medical databases, or the systematic review. And they try to check that whether these informations are relevant or it has the real studies. What is the impact of the particular study on the patient population? Then based on that, they will identify the two best medicine or single medicine. Example here, it may be the atropine or pyridoxine, and they try to apply it. Based on the treatment, they try to assess whether the patient is showing better information or not. Or whenever there is a better progress is there, it will become the added evidences. Suppose the person is or patient is not showing that specific, what we can call it as a response, then what will happen is it will be tried with another new existing drugs, maybe or new alternative. Suppose you say that glycopyrrolate you want to introduce, which is not mentioned in the guideline, then patient is improved. It becomes the new case signal, which is become the case reports. So like that, the evidences which is already existing, you are applying, and if you are not able to properly provide that specific information, and if they are providing the specific information and you are applying in the field, it not working, you are going with the new management, then this new management will be the added value for the evidences. So when you come to the evidence-based approach, you generally try to find out the evidences first, you are trying to apply it, and you try to evaluate it, and you look for the progresses. If this progress is considered to be the good, yes, it is strengthening the existing evidence. Suppose if it is not working and you are adding new thing or new some management strategy, it will become the added new evidence to the literature. So why it is evidence-based medicines are important? Usually it will help in the doctors to give the better patient care. It will uses the latest information, and it generally consider the patient's decision in the management. So that's why these evidence-based medicines are considered to be the important. So what is this evidence-informed decision making? After evidence-based medicine, these evidence-informed decision making are nothing but they are moving towards the guidelines. So particularly as we discussed, the systematic review and meta-analysis are considered to be the highest degree of evidences. Apart from this, guidelines are considered to be the more important. Even they uses the systematic review and meta-analysis as a concept, one of the important thing. Apart from that one, they also consider the other aspects like physician opinion and even the economic cost that is involved in considering the specific treatment. So systematic review or meta-analysis are either derived from the randomized control trial, observational studies. Any one of the study designs are considered to be the highest level of evidences. So generally we will say that systematic review of randomized control trials are considered to be the highest important in the evidence-based guidelines compared to that of the systematic review of observational studies. But however, nowadays, the concept has been moving towards the either rather than the study designs, quality of the methodology, how you are conducting. Suppose a observational study which is conducted with a good quality is also equally effective as your randomized control trial. So that's why nowadays what is happening is the quality concept is considered to be the important thing. So generally when we are conducting a systematic review or meta-analysis, we always conduct the quality appraisal of the studies. So even a systematic review of observational studies sometimes is considered to be the much better when compared to the systematic review of randomized control trial because of the quality of the included studies. So what I want to say is, even though systematic review and meta-analysis also considered to be the primarily a highest evidences, it all depend upon the what type of quality of studies you are including in the evidence synthesis. So generally, when you are considering the large number of studies are publishing nowadays, there is always a conflict between the one treatment strategies to other. Suppose if you are considering treatment A and treatment B, it is always a positive opinion towards the what we can call it as a treatment A, and also negative opinion towards the treatment B. Or you will have a positive opinion towards the treatment B and negative opinion towards the treatment A. So when there is a conflicting results are existing, especially if I take to the diabetes as a component, then there is I am searching for the which one is the best with compared to the metformin versus the glibenclamide. So I will get the studies where metformin are considered to be the best. I also get the studies that where the glibenclamide is also best. So finally what happens is when I am pooling the results, I completely considering the specific criteria to include all the studies which is treating the metformin and glibenclamide as a separate what we can call treatment strategies, and I make sure that good quality studies will be come inside for my synthesis of the information. When I am pooling, suppose if the data is presented to consider the meta-analysis, then all my finding with either metformin or glibenclamide to prove that the either one of them are effectiveness with the proper statistical evidences. So this is considered to be the very, very important, especially when you are conclusion of the important results you are going to get. So even systematic reviews are limited only for the qualitative synthesis. Always it is required some statistical proof to prove the effectiveness. This is what we are doing with the Reumen. So what we do is there, we try to quantitatively prove that treatment A or B is effective in terms of the outcome. So it is always refers that the either it will follow the treatment or it will follow the control based on the studies. When you including these studies in the meta-analysis, generally the population is considered to be the one of the thing. Always studies with the higher population is getting to the more weightage, and more weightage studies are always favors the appropriate treatment. So when you including the larger patient studies, it is always going to get the higher weightage. So this is one of the important thing which is you have to consider when you are doing the meta-analysis or systematic review. Generally, what is happening is these type of systematic review or meta-analysis usually help to improve the precision of the treatment, especially the statistically combining the results. That's what I told. It will either favor the control or it will favor the intervention with the appropriate statistical information. So what is meant by this systematic review? Systematic review is nothing but it is a review of clearly formulated question that uses the systematic and explicitly method to identify, select, critically appraise the relevant research and collect and analyze the data from the studies that is included for your review. So what is meant by that? Suppose I say, I want to understand the effectiveness of pralidoxime and atropine in the management of OP poisoning. So what I do is, I hypothesize that pralidoxime is considered to be the better choice, or we can say like that, instead of pralidoxime, we can say atropine is considered to be the better choice of treatment strategy in organophosphate poisoning. So when you select your hypothesis, either I can take one of them. Let us, as I told you, we move with the pralidoxime as considered to be the best choice in the management of OP poisoning. So what I'll do is, my research question is effectiveness of pralidoxime versus atropine in organophosphate poisoning. So I'm going to select that studies which is only conducted with RCTs as my inclusion criteria. Then you will going to set other inclusion criteria, maybe like that patient only admitted with the OP poisoning, mixed poisoning is excluded, patient with 60 years only we are going to consider, studies with reporting only 60 years we are going to consider. We are going to tell that patient with admitted immediately started with pralidoxime are going to consider. Whenever there is a mixed treatment strategies are there, other than the atropine and pralidoxime, we are not going to consider. So some exclusion inclusion criteria you will put it. Based on that, you will select your PICO. PICO is nothing but it is a key terms which is usually used to develop your search strategy. So population will become organophosphate poisoning. Your intervention here, we are considering pralidoxime. So pralidoxime become the intervention, atropine is become the your control. Outcome, I am mainly focused, my outcome is mortality, because whenever you say the poisoning, it become the mortality is considered to be the important thing. So that PICO has been derived, which will be conducted as a search strategy in the PubMed. And when you develop the search strategy, you apply in the PubMed, you will get the articles. So these articles you will going to download, and you will select the specific article based on the inclusion exclusion criteria. So you have to read that particular article. First, you are going with the title and abstract, whether my study, whatever I have got from my search, is whether it is clearly representing or not. From there, if the study I feel can be included, you are going to include, and then you will read the full text from where you want to see that all the outcomes has been properly reported. If it is reported, I'll take into that study into the my analysis. If you are getting a sufficient data, I will perform the meta-analysis by using the Raven. Otherwise, I will only conduct the qualitative assessment. So this is how I am going to do it. Mainly in between, you also check the quality of the studies by using the quality appraisal tools. There are several quality appraisal tools are available, which is particularly used to check whether the study is conducted in a good quality or not. Sometimes what is happening is, particularly in systematic reviews, we tend to include only the good quality studies. That time your review will be considered to be the good. But in general setting, what is happening, we cannot expect that all the studies, whatever included, will be the best quality, because some of the observational studies may have the some of the particular drawbacks. Example, I will tell you. See, there are several studies are available in the literature. Okay, you may be observed sometime reading. Initially, they are telling that in their result we have enrolled 200 patients. When come to the results, they are discussing only 150 patients. So they are telling that 100 patients has been enrolled in the each arm. Then when come to that one, they will tell that only the 150 together in the each arm. Either maybe you can say 75. That 50 data may not be there. It's a common thing you will observe in the articles. Okay, what happened to that 50 patients? If you are clearly considered that, and you have explained that due to the insufficient data, the 50 patients who are enrolled in the initially were not considered for the final analysis. If you mention that clearly, and your article is not able to justify properly that 50 data, why it is not considered and what is the fate of that patients, then it is considered to be the good quality. Suppose you dropped out that 50 patient information, you are not going to deliver anything, then you are only providing 150 patient data. Generally, for a reader, for me, it looked like a where that 50 patient data went. So anyone can get that specific doubt in that, whether there is a clearly fate of that 50 patient is not well defined in that specific article. So then the quality of that specific article under question. So this is how the quality appraisal we will check. You are assuming one patient, but finally you should be able to tell if you are not included, why you are not included. Or if you drop from the analysis, which factor made you to drop that specific patient group for dropping that group to drop from the analysis. So this sort of analysis will be done when we are using the quality appraisal. So the critical assessment of evaluation is very, very important, especially when considered to that of what I told you is in the clinical settings. So that's why when you do that, particularly in the systematic review, you also make sure that whatever that search strategy you have done, it is properly organized and with the specific inclusion exclusion criteria, and there is a proper appraisal, quality appraisal will be done for the included studies, and finally you have to do the qualitative synthesis including the quantitative pooling, which will result in the meta-analysis. So you are all knowing that what is the difference between the systematic review and meta-analysis. Narrative reviews are common thing which is we are doing our ordinary reviews. You people are knowing that how the narrative reviews are done. We will have our own keywords. We will generally search in the Google. We select on 10 articles. We'll write a review, which is generally qualitative and it is subjective. See, what is happening is I want to tend to have a passion that I'll only select these articles because they are published from the Lancet. They are published from the what we can call it as a NEJM. They have published from good journal with high impact factor. But it is always wrong that good journals will publish always good quality. Good studies are also published in the even medium journals also. So somebody is going with the journal type. Somebody is going with the study design types. He is telling that my review is only focused on RCT. No, it may not be always true. And there in the narrative review, you are not doing any quality appraisals. And you are not applying any type of search strategies. So in such cases, all these, whatever drawbacks are there, it will be overcome by the systematic review, where you already decided, I have to go this review by specific defined methodology. And for that methodology, you have to develop a protocol. Before initiating your review, you have to develop a protocol. That protocol should clearly explain how the study is to be conducted. And this protocol has to be registered. I always say this protocol has to be registered in one of the databases like a Prospero or Open Science. After you are registering the protocol, you have to start your search, and from there, with the specified time, you have to mention my systematic review is going to complete within the 6 months. And you have to start that search strategy. Then first pass, second pass, finally the specific synthesis. Either it will be a qualitative or quantitative. Qualitative is focused on mainly the systematic review. When you are using a quantitative, I told you it has become meta-analysis. Then you have to be published that one. So there are several protocols are available. If you require, you can go just to Prospero. Prospero will provide you is a platform where it provides the protocols. We have a lot of protocol, even protocol can be published. That is also I'm telling, protocol can be published. A good protocol of the systematic review can be published. Not only the meta-analysis and systematic review, even protocol also can be published. You just type the Prospero, remember that one. You type that rheumatoid arthritis or any diseases of your interest with these specific drugs and other things. There are several protocols will be available, and just to note down how they have developed the protocol. It is very, very interesting and it is very, very important also. Since you are the people who are in the pharmacy practice and we are practicing the pharmacy, the evidence synthesis is considered to be the one of the preliminary tasks. Even we are providing your all that drug information resources, correct? Majority of them are providing drug information. What is a drug information? Majority of them are, you are knowing the 7-step approach of the drug information, providing a query, correct? It is nothing but it is a systemic appraisal. Systematic appraisal is nothing but it is a type of a systematically you are searching the information. When we are doing in a large scale on a specified topic, then it becomes, and you are synthesizing the specific information from that, then it becomes the systematic review where you have a specific questions and from that you are working. But in our drug information, what we are doing is we are giving a query to the patient specific, but that information is also done in a systematic way of search. Correct? That's why drug information is also one of the systematic approach to answer the question. So in guideline development also we have a similar type of specific question. For that we are finding the answers. But what is happening is, in clinical scenario, we are focusing on one drug or two drugs. But in guideline development, such several questions, clinical questions will be there, which has to be addressed. Based on that, a specific guideline will be developed. So, if you consider the systematic review, stage 1 is a problem formulation, which is nothing but development of the research question. Stage 2 is the data collection. This is nothing but including the search strategy, first pass and second pass screening, including data extraction. Stage 3 is the data evaluation, where we are going to conduct the data evaluation. And stage 4 is the data analysis. And finally, the reporting the findings. So this is how generally the systematic reviews will go. Suppose, what is that specific framing a question for a review? So this is nothing but the hypothesis. Based on the literature search, we will get a specific question or the gap, and that gap we are trying to address with the objective. So how these questions are selected? Whenever there is a specific conflict is existing between the two aspects, that becomes the gap. One treatment saying, 10 studies are telling the treatment A is good, 10 studies are telling that treatment B is good. So definitely conflict will exist. That time we try to develop the specific question stating that effectiveness of treatment A versus B in specific disease condition. From there, you are developing your same thing, search strategy, then identifying the studies through the literature search, selecting the specific work which is required for your answering that specific question, assessing the quality of the studies, extracting the relevant data, summarizing and interpreting findings. This is how the framework of a systematic review will go. So if you see, this is a whole process of systematic review, starting from a specific question, which is our interest. We try to find it out in the literature, whether there is an answer is existing. If you are not having any answer, then you are developing a protocol. Protocol will be registered. Then you are conducting a search strategy. Based on that, a full search will be conducted. Again, the selection of the databases. Minimum 3 databases has to be selected. This is what the rule is. So generally, more than 3 is also considered to be the best. It can be the PubMed, it can be a Scopus, it can be an Embase, it can be Web of Sciences, it can be even ProQuest. So based on that, a specific search strategy will use it, and then you will identify the articles. Once the article has been identified from the different databases, you are going to club it, since in order to remove the duplicates. Because PubMed, when you search, similar articles will also appear in the Scopus. Or similar articles also appear in the Embase. So what we do is, by using a Excel, we try to merge that all the articles, and there is an option in the Excel sheet that is remove the duplicate. Once the remove the duplicate is removed, then you will have a handset of article which you are going to do with the title and abstract screening, full text screening. Then once that is full text screening is done, you are specifically selecting the articles which is required for your review based on inclusion exclusion criteria. Sometime we have to do the additional search also, which is through the Google, that we what is called as a gray literature search. Then based on that, we will try to include the studies, data extraction will be done, synthesis, then you are writing up your particular manuscript. This is how the overall process of systematic review and this thing. So what is this meta-analysis? So what you've done, the systematic review, same process you are doing it for even meta-analysis also. Once you are having a handful of studies with your hand, and you are finding that it can be have a data which can be quantitatively synthesized, then you are using the Raven to pool the data. Suppose I am giving example. There are 4 studies are there. You may imagine that which all are RCT, which will uses the pralidoxime and atropine. If the studies are giving the data of mortality, maybe you say that study A give 10 patients survived, 5 patients expired. Study B give around 20 patients survived, 10 patients expired. Study B will give 50 and 10, like that. You can able to put that in a Raven. You can able to pull that data which arm of the treatment, whether it's a pralidoxime or atropine, showing the better results. So it is nothing but a statistical proof. If data is available in the studies only, then you can do this one. Otherwise, it is very difficult to do the meta-analysis. It is a quantitative support or statistical support for your systematic review. Always systematic review followed by meta-analysis are recommended, which is considered to be the SRMA. However, in such certain cases, we cannot do the meta-analysis, so we have to restrict only to the systematic reviews. So when it is systematic reviews involved in with meta-analysis, we will call it as a SRMA, systematic review and meta-analysis. This is how it is goes. So just see, these are the sum of our systematic reviews and meta-analysis, how they are going. The first one is trade dilemma of pharmacotherapy in COVID-19, a systematic review, meta-analysis and implication. It is a policy developed type of systematic reviews, where what you are observing is, whenever you are looking especially this type of review, what it is telling that a trade-off dilemma of pharmacotherapy of COVID-19 means here the different systematic reviews has been considered, here different treatment strategies has been considered, which one showing the better effectiveness for the COVID-19. So this was published during that, whenever there is a, particularly what happened is COVID-19, there is a no informations are available. What we have done is, we have taken the different studies, which is telling the, this is the best management, and we are not focused on the single drug or 2 drugs. We have focused all the management strategies of the COVID-19, and we try to pool how the comparison of these pharmacotherapies varies between the population. So it is a comprehensive systematic review with the meta-analysis, and it also provides the recommendation that these drugs can be considered. So based on the available studies throughout the world, we have selected the studies which focused on management of COVID-19. It included studies treatment with steroids, treatment with you can tell antibiotics, treatment with even immunoglobulins. So different arms has been compared, and finally the recommendation has been drawn after giving this meta-analysis to physician. So it is what says is, it's not only the systematic review meta-analysis, even it is a expert opinion also. You go through this article, you will come to know how the systematically information has been synthesized and presented. This is another one. Efficacy and safety of the corticosteroids in acute respiratory distress syndrome, an overview of meta-analysis. So what is happening? You know, everyone is, what is an ARDS? ARDS is nothing but acute respiratory distress syndrome, which is commonly associated with most of the infectious diseases. So there is a dilemma is there, which type of steroids has to be used in these clinical conditions, whether it is to be low dose, whether it is a high dose, whether low dose with long duration, low dose with shorter duration, high dose with shorter duration. So generally different arms has been compared, And finally, a particularly information is pooled, which one is the best practice. So here, instead of taking the research studies, we have taken all the systematic reviews which is published with respect to the corticosteroids. And here the opinion has been drawn from the systematic review, published systematic reviews. So that's why it is the systematic review of meta-analysis or systematic review of meta-analysis, like that, or overview of meta-analysis. Here also we have conducted quality appraisal of the systematic review or meta-analysis which is already published. So one is systematic review, another is here we have conducted overview of that one. It is nothing but it is also systematic review, but systematic review of meta-analysis published in that specific area. This is, you see, artificial intelligence in acute respiratory distress syndrome, a systematic review. So artificial intelligence is a growing area. You all know that one. And how this artificial intelligence has been used in ARDS. This is also considered to be the one of the important factor where it is conducted the studies which is particularly focused on different aspects, maybe a diagnosis, maybe a treatment, maybe a progressive assess. So in all the areas where there were and artificial intelligence has been applied, we have conducted in terms of a systematic review. So this is another one where N-acetylcysteine in rodenticide poisoning. So you know that all rodenticide poisoning, N-acetylcysteine is considered to be the one of the management. It is nothing but rodenticide is nothing but it is a rat poisoning. So how this N-acetylcysteine is effectiveness or effective in terms of rodenticide poisoning. So we have conducted a systematic review of already studies which is published with respect to the rodenticide poisoning which uses the N-acetylcysteine. So we have conducted a meta-analysis for separately for RCT, observational studies, and we checked that whether really N-acetylcysteine proved the effectiveness or not. Here, apart from the qualitative synthesis, the study is proved with the even meta-analysis also, the quantitative supporting of that. So this is another one, systematic review and meta-analysis of global prevalence of the neurotoxic and hematotoxic snakebite anomination. It is published in one of the WHO journal where particularly we observed that what is the prevalence of neurotoxic and hematotoxic snakes, particularly in the global settings. So now you are telling that what we are going to get this global prevalence with that neurotoxic and hematotoxic snake bite. This is because why it is important is because it is very, very important. We will come to know how these distributions are occurs, particularly in the globally with come to the neurotoxic and hematotoxic snake bite. Whether the prevalence is more in tropical condition, whether the prevalence is more in which Africa, India, Asia. Based on that, a data will be helpful, particularly to designing the policies. Even such data is very, very important for your WHO-like agencies to provide the developing the policies. So even the systematic review and meta-analysis of the prevalence studies also considered to be the important because they are plays important role to understand the disease burden. Not only the always the systematic review meta-analysis has to prove for your management, but also even prevalence are considered to be the important to provide the develop the policies. This is another one where significance of Apache 2 as a predictor for mortality for the paraquat poisoning. So we always say, only the prevalence is there, only management, even the which type of assessment, severity assessment scale is also considered to be the important. These are all called as a particularly useful how to Apache 2. Apache 2, you all know that acute physiological chronic health evaluation score used to check the patient progression. So systematic review of such tools also can be done. It's not only the management, it's not only the prevalence, even the scales, whatever you are using, how they are best to predict. These are all called as a prediction models. This is one of the recommendation papers. If you observe that it is a scoping review, but even though it is a scoping review, it is a recommended paper. It is a paper which is focused on the recommendation. So what they are telling is what all the important things you have to monitor when a patient is having a diabetes and mental illness, what all the important parameters you have to monitor, and what is how you should recommend which particular type of test has to be done in which time. Suppose a patient is in diabetes and is having a schizophrenia, he will have a diabetes medicine also, he will have a antipsychotic medication also, and definitely he is, because of the psychiatric illness, he don't have any control on the diabetes, he will eat. So it may lead to a long-term complications. So this paper suggesting that what all the important parameters you have to look, and what all the general barriers existing in the globe, how it can be overcome. This is a very good paper. You can read this one, it will give you clear-cut idea how search has been done, how gaps has been removed, and what is recommended. So this is another one. It is used as a diagnostic markers. Diagnostic markers can also use the systematic review. So which diagnostic marker? When there is a 10 tests are there, 10 different tests you are using, which one is considered to be the best? So once this evidence synthesis is done, what is the next? So next step is your implementation. So you have defined your objective, you have identified the data, you have organized the data, you have performed the data, you have draw the conclusion, then finally whatever data driven decision is, the implement and evaluate. Now you are telling that you are doing a systematic review, you have done, you have published. Now how to do and implement and evaluate? Recent all pharmacy practice studies are associated with mixed method approach. In the mixed method approach, one component what we include is the systematic review and meta-analysis. Second component, what we do is we will try to collect the opinion from the physician and patients with respect to the specific condition and their management aspects. So we'll club together, we will develop our own strategy with the do these two things, and we will implement in the clinical setting, which is the best. So this is a one type of study approach where evidences from the literature are collected, specific information from the respective stakeholders has been collected, evaluated with respect to the published evidences and the opinion. Final strategy has been done and it will be evaluated in the clinical setting to the locally. This is what the data-driven decision, which uses the research evidence, stakeholders' perception, and finally developing a one strategy implementing in the clinical settings. So this is whole process how the generally guideline goes. So any evidences you are collected from the systematic review, you have to assess its creditability by using a grade framework. And once that evidence are graded, then it is become evidence-based decision. From there, it is become the recommendation. The recommendation has been reviewed by the committees, which is generally consisting of experts. From there, you are required to particularly taking their opinion, this will be considered based on the even patient perception also, which will collaboratively together done finally for the recommendation. So systematic review and meta-analysis are considered as a preliminary part. From the whatever data you have developed, you have to convert it into a grading system. Your grading of the article will be done by using the Grade Pro. Once the Grade Pro has been developed, then it will be given to the steering committee, which will decide whether all the analysis has been done properly, proper conclusion has been done. And meanwhile, the pharmacoeconomic process will also considered by the committee. Finally, they will evaluate whether specific treatment strategies holds good to the Indian condition. Based on that, meanwhile, expert opinion will be also taken along with the involvement of the patient parties or one or the consumers. From there, finally recommendation will be done. This is how the guideline development process will go. So you know that what is a guideline? They are the systematically developed statement which assist the practitioner and patient to take the decisions. Some of them I'll show you like this. These are the guidelines, which is as a pharmacy practice, I need not tell you all these things. This is well established guidelines. Now come to the evidences. Level of evidences are considered to be the important. As I told you, if you say that grade A is considered to be the best evidences which is conducted with the well systematic multicentric trials, and there is a proper meta-analysis will be there, and it will be conducted global. When you say B, it is supportive evidences from well-conducted cohort studies. It will be either from the meta-analysis or the big cohort studies. And C is the combined evidences from the poorly controlled or uncontrolled studies. So RCT is always considered to be the top. But as I told you, remember, it should be having a good quality. Quality matters a lot. So this is all the pyramid which is we are showing. Not spending on this much because it is already known the thing. So level of evidences are based on the grade of recommendation. So grade pro we are using to assess what the information we are derived from the your particularly systematic review will be through grade pro we assess its creditability. So this is how the grade level will go. Same thing, evidences from the systematic review or meta-analysis of RCTs. Evidences from the level 2 is evidences from the obtained from the well organized of one RCT. Then it will come to the cohort studies. Then it comes to the case control studies. Then it will comes to the meta synthesis. So like that, these levels will go. This is how the evidence pyramid is here considered to be the evidence-based guidelines are considered to be the top priority, followed by meta-analysis, followed by systematic review, then individual studies. These are the certain guidelines. When you say A, it indicating well-designed conclusion derived from the well-designed RCTs. B is become cohort studies. C is become uncontrolled studies. So actually recently ICMR has been proposed this center of evidence-based guidelines to develop the guideline. So ICMR DHR proposed a recent concept in 2024 to develop a guideline. For that, they have selected 24 technical centers, which is you also known as a 27 technical resource centers and 5 specialized hubs with the mission of to improve the healthcare quality in India, to lead the effort gathering and coordinating healthcare research, to make sufficiently back the guideline and accessible to the healthcare professionals. So because of this one, they started the development of the guideline with providing the distribution of the task to the different part of India. And we are the one of them in the Department of Pharmacy Practice and Manipal College of Pharmaceutical Sciences. Again, there is a one more person, Undela, Krishna Undela. He is also one of the person who is actively involved in this guideline development. So even his department also considered to be the one of the center. So particularly, as we know, we have initiated our process through the clinical studies. Now we are slowly moving towards the development of the evidence synthesis. And as a part of the core of the practice, we are now in the journey of developing the guidelines. So decision making is not only by the physician, also it is a multidisciplinary approach where pharmacy practice is considered to be the one of the key role plays important in the decision making. So in the decision making, we have a several process, as I told. The systematic review and meta-analysis are considered to be the primary set to development of the your evidence synthesis. Thank you for providing me opportunity. Any questions are there? I'm ready to take.
So much, sir. That was indeed very, very informative. We had a few comments from our listeners also saying that this was very informative for them. I would just like to bring to your notice of some of the questions that were picked up as a part of your presentation, sir. At the outset, I would like to know that at some part of your presentation, you are mentioning that whenever you do a literature review, while conducting a systematic review or a meta-analysis, it is good if you can refer to 3 or more than 3 databases to get access or to collect the studies that fits into your PICO question. To my knowledge, I know that PubMed is one database where every Indian can access it for free.
Yeah.
And Scopus is also something that is mentioned by you. So do you think, can you give us any other databases where one can access at least the abstracts for free, sir?
Sir, actually, again, these PubMed is a free, as I told you. PubMed is free, and apart from that one, most of the things are paid only. Paid only. Another is a trip database. Is there trip database you can use? It is freely available. Trip database.
Okay.
Somewhere you are even available with particularly because PubMed is always associated with the Medline, but nowadays PubMed problem is they are telling that funding is not there. So you may observe that when you type in a PubMed, you will get that one. Funding is not there. Information whatever provided may not be updated. So probably this free database is considered to be the one of the challenges in the future research.
Okay.
Yeah, if suppose someone is interested to do and definitely you want any help from that one, you can give my name or our center name where we can definitely help you to getting the articles, screening and getting the articles. We will help you.
Okay.
But, yeah, because since we are working as a resource center, we have the availability of all the databases anywhere. If you are really interested to conduct such type of review or whatever is there, we have a research scholars and you can discuss with us, and we have even what we can call as a free consultation also regarding how to do the systematic review. We are conducting free workshops also. So it is none of the workshop will be charged. It is freely conducting, and we are conducting monthly ones. Anyone coming really interested, he can come, and definitely even without not coming also, if they want to develop any such type of work also, they can contact through mail. Definitely we will help them. Otherwise, as you told, there are only few databases available. As I told, one is PubMed, one is Trip database also you can check. It is good one.
Okay.
Yeah. Because Trip database, what is happening, you will get majority of the articles. Even nowadays, I think so ProQuest is also considered purchased by many universities. Suppose if you go to the Karnataka, particularly the Rajiv Gandhi University, they have their own websites Particularly, they will give the SS for certain things like that. In your university also, they may have the certain databases.
Okay.
But whenever you are doing guidelines, says minimum 3 databases as they recommended. Even such
Okay.
studies published with PubMed also there. It's not like that only this one, but studies are there.
Okay. As an add-on to the same aspect, sir, it's very some of our delegates are uh, felt very happy to know that Manipal Institute is also one of the center for development of guidelines. So, in the flowchart that you just showed us, where the process starts from developing a systematic review and the entire journey where it makes all the way into the guideline. Can you once tell us that what exactly happens at Manipal Institute as a part of this framing this guidelines, as you are one of the 27 members that are given with the responsibility of developing this guideline?
What happens is we usually here we have given the two main responsibilities. One is developing the capacity building program for the meta-analysis. Another one is developing the whatever research question has been developed by the ICMR in specific development of the guideline. They will send to us. Suppose if I say I want to understand what is the antibiotic prescription in the skin and soft tissues, what they are doing is their steering committee, they generally take this task and they will develop a 6 to 7 clinical questions. Maybe you can say that example, I want to know in that specific broad topic, antibiotic usage in skin and soft tissue. So what they will do is they will divide that whole guideline into a 8 or 9 component. Maybe one is what is the prevalence of skin and soft tissues in India and the subcontinent. Because since it is a developing for India only, they will look on the India or in subcontinent. Then what is the prevalence in especially age-wise categories of the skin and soft tissues, which are the resistance pathogen. This is the sensitive antimicrobial agents they are using. Then they will pull out that what is the clinical outcome, especially associated with that. So all these comprehensive, whatever the information is that they are breaking into a 5 to 6 questions, which will we have to take the data from that one and we have to answer it. So either you have to do it systematically synthesize that one and give the qualitative answer, or sometime whenever there is there meta synthesis is there, you have to conduct the meta analysis also. So all that will be framed in their framework as a report and it will send to the ICMR on the specified period of time. Suppose if they are giving us for 3 months time and we have to finish all that thing. Sir, it is a very hectic job because what is happening is in our first task, we got around 60,000 articles.
Okay.
One person screening the 60,000 article, it is not easy.
Yes,
So
sir.
since I am having more than 17 PhD students, I can able to divide the task and we are able to finish. Otherwise, it's very difficult because finally you get around 400 articles, which is you have to do the full text reading.
Hmm.
1, 3, 4 article per day also, you're not able to cross 100 days because they have given only 3 months, 90 days. In that, you have to do the screening also, you have to do the first pass
Data
also,
extraction.
second pass also, and data extraction. So this is the task what we are getting. These are the two objectives we are working on that one. And happy to say that is our one of the best TRC, and it is also recommended by the ICMR also. It is a good TRC because we are working on time also, and moreover we have to publish the papers also. That is also our one of task is there. And whoever is approaching us regarding especially for the help of the such type of training program, we are going to arrange. Suppose you are tomorrow you are calling here, sir. We have a people of 30. You come and deliver, and we are going to come and deliver you for 3 days workshops. So it is our duty, but only we conduct once in month because of our academic load. We cannot every time travel. Monthly one program we are conducting to the site. We are not only conducting in Manipal. We are going to the site where there is a 30 people are there. If there is, we require minimum 30 people. We can train them hands-on with all how to conduct systematic review and meta-analysis without any charging. Only the issue is when we conduct these workshops, we should not take any registration fees. We also should not take any remuneration. So these are the aspects. So any institute or anyone is involved in your this one is interested that we have a 30 people and we are, you please provide us, means we will able to come and we are able to deliver the lectures. We will, 3 people will come. Maybe you have to take care of our accommodation, that's all. Just even travel also, you need not bother about that one. So you're able to come and we will deliver the lecture. That is how it is goes.
Okay, sir. That's really great to know, sir. And the last question probably is that at some part of your presentation, you said that you also did a you did a systematic review of meta-analysis. So there are a 4 to 5 meta-analysis and you carried out a systematic review.
Yes, yes, sir.
So in such conditions, what would be the specific PICO, sir?
Yes, PICOs will be remaining same only, sir. When you come to the systematic, there is a one thing called PICOs. Yes, yes, is a study design.
Okay.
In study designs, you are selecting systematic reviews. That's all.
But still, you still have a research because the thing is,
No. What will happen, sir? What will happen is, suppose when you are developing a PICO, suppose I want to do that. What is the effectiveness of diabetes, effectiveness of glibenclamide and metformin or any drug A and B in diabetes with respect to the HbA1c or any type of, you can say, long-term prevention of the long-term complications. So I'll put that PICO. The PICO will be remaining same, diabetes. Maybe you can say we can consider the metformin as an control, glibenclamide as an intervention. Outcome will be the either diabetic control or we can say long-term complications. But when come to the study designs, you have in PubMed and other things, there is one option called study design selection. So we will tick in the systematic review. Instead of all that RCT, case control, everything will be there. We will tick the systematic review. Then what it will do is, it will select only the systematic review which is published on these 2 drugs compared to the diabetes.
Okay.
So in the selection of the studies, you have to, PICOs will be remaining same only. In the selection of studies, you have to select the systematic reviews. That's all.
Okay, sir. Okay.
And that is while required. See, whenever there is a contrast meta, even systematic reviews also, sometimes what is happening, many people will publish. It is also in contradictory result. That time, such overview will be very best one, and it is having a high validity also.
Yes, sir. I was actually about to ask that because we conduct a meta-analysis or a systematic review when we have a contradictory evidence from RCTs or cohorts. So if we are doing a systematic review of meta-analysis, then probably there must be some kind of contradictions between
Definitely. There are so many things are there, sir. Even example, one area I'll tell you is vitamin D, whether it is really having a problematic issues with the diabetic complications. Several, if you go to that one, even several systematic reviews are telling that it is better. Somewhere it is telling no effectiveness. Sometimes it is telling it is a contradictory result. So in such condition, if 10 systematic reviews are there, you can pull it and you can check it out, that one.
Yes, sir.
Yes.
So that's all we have. That's all the questions that we have for you, sir. And again, that was very, very informative. And in fact, you gave us an extra bit of information saying that the institute is ready to take workshops if we can provide some more than 30 plus audience. I think some of the delegates in this session would take that opportunity and might approach you on this note.
Yes. Definitely, sir. Definitely. Because since it is a part of the program and it is also capacity building program, but definitely we want to do it. That is more important for us, see, as a part of the thing, because rather than many of the time what is happening, people may not able to travel from outside to here.
Yes, sir.
So that is, rather than I am telling 30 people to come from across this one, so it is sometime we will prefer, because that one group wherever is there located, they will get the information. So
Yes,
that
sir.
is one approach. Actually, ICMR gave us a lot of approaches how to do that one. So we have conducted like this, and this is appreciated by them. Because
Yes,
rather than what is happening, only the condition is, sir, you should not take the registration fees. That is our main motto. You should not, and in that brochure, it should be very clearly mentioned that you should not take. There is no registration fees. Any other things you are taking, you should not, maybe for food or something you may take, but you should not mention that one. That's all. That is what they want.
Okay, sir. And last question, sir. Sorry, sir. Even Revman is still available as free for somebody to download and carry out the meta-analysis, sir, or
No,
is
no, no, no,
I
no.
heard that.
They can do, sir. I think so. What is the thing is there is a one more options are there. See, there is a now Cochrane is offering you now the memberships.
Okay.
If you go to the Cochrane, how to get the membership? You can go through that. There are several small activities are there. Maybe you are helping them to check the review. You are helping them to promote the things. So for that, points has been assigned to you, and by getting that points, you can get the membership easily. You suppose one specific review, you have to review and you have to give your comment. If it is like that, it is there. If you have submitted that review, they will give you 500 points.
Okay.
And two such reviews has been done, or you are promoting any activities, like you are attending, you are referring the Cochrane to others, your friends, you will get the points. So
Okay.
by that, you will get the 1 year membership of the Cochrane free. And
Okay.
based on that, the Raveman, all the material you will get it freely.
Okay.
That is a good option actually. That is a very good option where you need not pay anything. But yes, you have to do some activities which is they are suggesting.
Okay. I don't think this was the case previously, sir, for getting access to Revman.
No. Raven also you can do, but it is a limited access, sir. It will be, I think so, trial base is there for only 2 weeks or something. Is that you can get it.
Okay.
You can get it that one. You can get it that one, but only the, I think so, 2 weeks it is.
Okay.
But when you become the member, it will be you are getting freely, continuously you will get it.
Yeah, that is while registering at Cochrane Library and then promoting some activities or doing some review.
Activities and reviewing their reviews, protocols, or whatever is.
Okay. Okay, sir.
Okay.
Thank you so much, sir. I once again wholeheartedly thank you for accepting this invitation from our institute and taking the session today. We look forward to have a lot of collaborations with you and with your institute for the development of pharmacy practice in the future.
Fine.
Thank you so much.
Fine. Okay.
Thank you so much. And I thank all the delegates for participating on this platform today. We see you all tomorrow at 11 a.m. Thank you. And with this, we are leaving the session.
Okay. Thank you, sir. Thank you.